Almost 50 years ago, a project to eliminate smallpox uncovered another urgent crisis. Blindness was further reaching and more widespread than anyone had realized. This discovery marked the beginning of a new mission to eradicate avoidable blindness in Nepal.
And after the survey, we wrote to different countries to help Nepal. So many people came from different countries and they helped Nepal.
In 1970s, eye care service in Nepal was very preliminary stage. Government of Nepal has one central hospital in big hospital, one eye department, and few other regional hospital has few eye departments. That's what the total eye care service provided in the country. Therefore, there was a big long list of the cataract operations, almost 6 months in Nepal. And many patients who wanted to do the immediate cataract surgery need to travel to India in the Sitapur or Darbhanga.
Research revealed the critical need for eye care services, driving NGOs to tackle major challenges and create greater opportunities for more people to access care.
So with the support of the local participation and international agencies, we established different zones, different areas where there was a maximum prevalence of blindness to establish the eye care services in there.
The global support is needed to build that network, the network where they can share their learnings, their innovation and technology. They can also support the resources.
Two key priorities were identified to strengthen the system: technology and human resources.
Combining ophthalmic practice with the concept of technology is probably very, very effective, and it makes ophthalmic practice efficient, and we can reach more people. I would say that technology in cataract surgery, in retinal surgery, and in refractive errors, and right at the ground level. For example, use of smartphones, with slit lamps. And smartphones, having a small slit lamps in themselves, I think has a great advantage.
Since there was a serious shortage of ophthalmologists, optometrists, and ophthalmic assistants, unfortunately or fortunately, since we were a part of the university, we could not take anything less than graduate programs. But many of our faculty members did take part in training the ophthalmic assistants, and that's the role they played. But our main focus was on training qualified ophthalmologists and optometrists.
Through these inspiring efforts, Nepal became a hub for innovative eye care, attracting both global and local expertise. A vision for a network of hospitals with specialty equipment and resources to cater to more people than ever before was born.
On 1st of March 1993, Himalaya Eye Hospital was inaugurated. 15th November 1996, Mechi Eye Hospital was inaugurated. From these two hospitals, so far, we have already served more than 8 million patients and performed more than 800,000 surgeries. These two hospitals are pivotal to change the eye care landscape in Nepal.
Not very easy. It is very resource intensive. We need lots of money to buy the equipment, to hire the people, to run everything. But at the same time, that should not hold ourselves. We need those establishments to really truly go into the crux of the matter and treat the patients.
The Nepalese government took a proactive lead in shaping and strengthening the country's ability to provide quality eye care.
Eye care in Nepal have come a long way from the prevalence of 0.8% blindness of 1981 to 0.35% in 2010 to 0.28% in 2022. With all the geographical, managerial, human resource, and so many challenges, we have come a long way. And that's been possible with very successful public-private partnership, support from different development partners, the willpower of the government of Nepal, eye care have seen a significant growth and improvements in Nepal.
Our visionary leaders in Nepal, who have a very good passion, who had a very good dedications, who has a very good collaboration between themselves, has resulted in a significant reduction of the blindness in the countries.
What began with a few visionaries has become a thriving eye health sector driven forward by those committed to better eye care for all. As we gather here in Kathmandu, we remember these remarkable visionaries of the past and celebrate the progress made, the lives changed, and the ongoing efforts to ensure that eye care remains accessible to everyone who call Nepal home.